Hi, this is Dr. Linda Kiley, the Holistic Urogynecologist, and I'm playing the blues tonight because I'm going to talk to you about something that tends to give people the blues, and that is a word called Nocturia. So what that means in regular terms is getting up a lot at night to pee. So that's not generally something most people like doing, and if you get up 2 or more times a night, you meet the definition of nocturia. I have some patients who get up 5, 6, 7 times a night, every hour, every 45 minutes, and it can be extremely disruptive to your life, very difficult to deal with, leave you tired in the morning and very frustrated. So what we're going to talk about here is how it's evaluated, and then a little bit about how it's treated. So I'll tell you first of all what nocturia isn't, and that is not insomnia. So one of the things we try to figure out at the very beginning when I see somebody who's complaining is, do you have poor sleep? Because if you have poor sleep and you're just getting up to go to the bathroom because you have nothing better to do, but you really don't feel like you need to go, you're just doing it out of sort of habit, that's very different, and you need your sleep evaluated and treated, and hopefully that will improve your nighttime urination problem, because that's not the real problem. But aside from that, if we're actually looking at someone who is awakened by their bladder with the need to get up and pee in the middle of the night more than once and more than twice, certainly, then we're going to try to figure out why this is happening so we can make it stop. So there are 2 basic types of nocturia. There's low output and high output. There's a special case in a situation where someone is not able to empty their bladder and it gets overfilled and they only empty a little bit at a time. So every time they get up, they're just getting a little out, but it's staying very full. That's a different situation, and I always evaluate for that at the first visit so that we can kind of put that out of the picture. But aside from that, the 2 basic types of nocturia are high output and low output. So high output is going to mean that you are producing 30% or more of your total urine volume in 24 hours in the overnight period when you should be sleeping. If it's less than that, then it may be that you're just drinking a lot of fluid, particularly at bedtime. And if that's the case, we can fix that by reducing how much fluid you drink in the evening and at bedtime. But at any rate, doing a 3-day fluid diary is the most helpful thing for me. So what I ask my patients to do as part of my initial evaluation is measure and record all liquids that come in and all liquid you produce for 3 days in a row, for a full 24-hour period for 3 days. So I want a slice of your life as it pertains to ins and outs. Once I see that, I can determine whether or not it's high output or low output. If it's high output and we don't see that it's due to high nighttime intake, then we have to think about what are the other medical conditions that might be causing it. A very common one happens to be sleep apnea, which is quite common and often not manifesting the same symptoms in women as men. In other words, a lot of times women don't snore the same way men do usually with sleep apnea. So even without a history of snoring, if someone shows signs and symptoms of sleep apnea, I send them for an evaluation. Oops. Because that can be treated, and that should improve the nighttime urination problem as well. So we got to do that. There are other conditions, medical conditions, that can cause high output nighttime urination. So in other words, we have to look at, is there diabetes? Is there heart disease, atrial fibrillation, so abnormal heartbeat, irregular heartbeat problems, things like that, kidney disease, swelling in the extremities, peripheral edema. Those are things that can cause high output urine at night. So we have to look at those things to determine whether there's another underlying cause that needs to be treated in order to get at that problem and successfully alleviate it. In the case of low output nocturia, typically the findings are going to be either a urinary tract infection that's undiagnosed, interstitial cystitis or an inflammatory condition of the bladder, a musculoskeletal condition that causes inflammation in the muscles around the pelvis and the tissues that can create a sense of urgency even when there's not a lot of urine. A neurological condition can also do it. So those are things that I have to look for as well if I see a low output situation. So first step in evaluating is find out exactly what's going on, get data, and then once we do that, we move to the next phase, which is evaluate the additional potential conditions that could be causing it and begin pelvic therapy as appropriate, fluid modification as appropriate, and then after that, if indicated, medications that may help. There are a few medications for frequent nighttime urination, but they should not be given, and please do not just take them because you're frustrated until you've had a full evaluation. So most of the time, once we do this type of evaluation and undertake a treatment program, we're quite successful in reducing the number of nighttime urination episodes. Bottom line, see your urogynecologist or your urologist and go over all of these issues. Make sure that you have been thoroughly evaluated so that you're likely to get a good result and a satisfactory result from your treatment. So this is Dr. Linda Kiley, the Holistic Urogynecologist, saying, please don't sing the blues. Just get seen.